Good evening, guys. This is your discussion your bonus one. We're discussing England's hospice crisis. Okay, so here we go. The headline: Dying patients facing cutbacks amid hospice crisis captures a deeply troubling reality unfolding across the UK hospices, which provide vital end-of-life care, are being forced to scale back services due to mounting financial and operational pressures. The surrounding coverage paints a stark picture of a sector in distress with profound consequences for patients, families, and communities. Root causes: a system under strain. At the heart of the crisis is a chronic funding imbalance. Most UK hospices operate as independent charities, relying heavily on donations and limited government support. In 2023-24, many of these organizations reported significant defects with expenditures far outpacing income. This financial squeeze has been exacerbated by inflation, rising energy costs, and workforce challenges, leaving hospices with fewer options but to cut back. The result: a wave of operational reductions, staff layoffs, and hiring freezes. Closures or deregistration of inpatient beds, uh, culturement of community-based palliative care teams. Tangible impacts. These measures are not isolated incidents, but part of a broader pattern of retrenchment across the sector. Tangible impacts on patient and families. The most immediate and painful consequence is reduced access to care for dying patients. By the end of 2024, approximately 300 inpatient hospice beds are expected to be withdrawn from service. This means fewer places for patients who need intensive symptom management, emotional support, and dignified end of life care. Community-based services such as home visits, bereavement support, and day programs are also being scaled back, leaving families to shoulder more of the burden without professional guidance or respite. Geographically, the crisis is creating black spots where hospice care may vanish entirely. These gaps are especially dangerous in rural or underserved areas where alternatives are limited and hospital based care may be ill equipped to meet the nonsense needs of the dying. Hospice leaders and advocacy groups are sounding the alarm. They warn that the crisis is unfolding just as demand for palliative care is rising, driven by an aging population and increasing rates of chronic illness without urgent intervention. The UK's risk a future where end of life care is patchy, inadequate, and inadequate and insufficient. Crises for reform include reimagined funding model that guarantees baseline support for hospice services. Calls for reform include a reimagined funding model that guarantees baseline support for hospice services, greater integration of hospices into the NHS framework, strategic investment to stabilize staffing and infrastructure. This isn't just a healthcare issue, it's a moral one. The ability to die with dignity, comfort, and compassion should not be should not depend on geography or charity fundraising success. The bigger picture. The hospice crisis reflects deeper tensions in the UK's health and social care systems. It raises questions about how society values end of life care, how resources are allocated, and what kind of resources are and what kind of safety net exists for most vulnerable as hospices struggle to stay afloat. The risk is not just to individual patients, but to the ethos of compassionate care itself. In short, the headline as a warning unless systematic changes are made. Dying patients will increasingly face a fragmented, under-resourced landscape at the very moment they need care the most. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.